Well, this morning, hundreds of international medical graduates find themselves stuck in a bottleneck after a recent pause in processing their visas.
So the foreign-trained doctors match with U.S. hospitals. Well, they now face uncertainty. As CBS News Miami's Janet Shamlian explains, it could strain staffing at medical centers all across the country.
Hi there.
Jacqueline Gree is a Canadian in her fourth year of medical residency at UConn in Connecticut, one of thousands of international medical graduates who come to the U.S. each year, serving as frontline caregivers in U.S. hospitals.
How integral are they to the operations here?
Our healthcare system would fall apart if we didn't have residents to serve patients and help provide care. Interns arrived today.
Dr. Rebecca Andrews runs UConn's internal medicine residency program, which has 189 residents, some of whom can't get into the country due to the Trump administration's recent pause on their specialty J-1 visas.
Most of these residencies start in July. If these students aren't here, what happens?
We just started orientation today, but I know that 10 of our interns are not here right now, which means we won't have as much time with them to prepare them for what they're going into.
A resident is a doctor who's graduated medical school and is undergoing specialty training, working in a clinic or hospital before being fully licensed. In the U.S., about 25% of residents are international students, and there's still a shortfall. Nationwide last year, about 2,500 slots went unfilled. International medical grads tend to work in underserved communities or in rural hospitals, where domestic medical grads are less likely to train.
It is, shall we say, brutal.
Dr. Isaac Opoli is a former medical resident from Nigeria who went on to become president of the American College of Physicians.
How does that impact healthcare for ordinary Americans?
They are the workhorses of the medical system, and many medical systems would simply fall apart if they did not have residents within their buildings.
The Trump administration last week lifted the pause on visa appointments, but it's uncertain how quickly the residents can get back up to speed.
Even if the program is back in full force, are there some repercussions from what's happened already?
Yes, we are losing an opportunity for acclimatization and orientation of these physicians before they begin their duties on July 1. It's going to be a challenge for very many residency programs.
A race against the clock to fill critical roles in American healthcare. Janet Shamlian, CBS News, Farmington, Connecticut.